Hello, I'm Abou-Chebl from Louisville, Kentucky, a stroke neurologist, and with me is Professor Derk Krieger. Hello.
Hi, Alex.
Today we're going to talk about carotid artery disease and stroke. Can you tell me about the prevalence of carotid disease and stroke?
Yeah, the prevalence of carotid artery disease and stroke is dependent on the age of the patient. It is, in general, about 1/5 of the patients that have carotid disease that present with a stroke in the emergency room, but it gets more likely in elderly people. And it is also a little bit dependent on your racial mix. So it may be, Alex, in the US it is different. What is your opinion?
You're absolutely correct. Depending on the patient population, Asians, for example, those of African descent have more intracranial atherosclerosis, whereas those of European descent are more likely to have cervical atherosclerosis. Okay? Since it's very prevalent, let's talk a little bit about treatment.
Yeah, the treatment is definitely dependent on the status of the carotid disease, and that means not only how severe the stenosis is, but also whether it is symptomatic or whether it is an incidental finding. The way that we usually evaluate these patients with Doppler ultrasound, at least in white populations, because most of the carotid stenosis can be seen in the neck with a duplex ultrasound easily, but as you mentioned, in other population, it may have to be evaluated with an imaging strategy such as MRA or CT angiogram that evaluates the whole supraortic vessels. And then in terms of the treatment, if you have a symptomatic patient, we usually favor repair of the carotid at a stage when the carotid is about 70%. 60% is borderline. You may or may not decide to do surgery, depending also on circumstantial evidence whether the carotid is actually the cause or whether this is an incidental finding. But we also have to consider that the data on the surgery versus medical therapy are 20 years old, and we have more powerful treatments now, and we're getting more powerful treatments every year that makes the medical treatment much better than it was in the trials that made us come up with our guidelines. So I think there's a moving target.
I agree, but I think it's important to emphasize, though, that still, if we were to base treatment decisions based on evidence-based guidelines, since the only data we have are data from 20 years ago, they still support revascularization in symptomatic patients as well as selected asymptomatic patients. And so while we suspect that modern best medical therapy may prove to be superior to surgery, we still don't know that. And so I think it's very important to have that kind of discussion with your patients. In regards to treatment, let's talk a little bit about revascularization with carotid endarterectomy versus stenting. Excuse me.
Versus stenting. Yeah. Well, the stenting is a treatment option that is only available since about 15 years maybe. It has since then taken up a lot of interest because it is conceived a less invasive procedure without a scar in the neck than surgery. But the data is not quite clear, and it is interpreted in different regions according to resource availability. So I remember that we had the discussion after the trials came out, the European space study, for example, that stenting came out inferior to surgery, well, mainly because the interventionists were not as experienced as the surgeons were, so it's a matter of the surgical or interventional complication rate rather than anything else. If you look at data in terms of long-term monitoring, again, surgery seems to be a little bit better than stenting, but we don't know whether that really makes a difference. So I think it's also open. But what do you think as an interventionalist?
I think it's open to interpretation, as you said. Unfortunately, it's time to end the conversation. So to summarize, carotid artery disease is very prevalent in patients with ischemic stroke. There are several treatment options: medical therapy, surgery, and carotid stenting, and treatment should really be individualized based on the needs of the individual patient. Thank you.
Thank you.